Hello, my name is Stephanie Velasquez, and I am in the Health Assessment Lab group on Wednesdays at 1 p.m. with Amauri. I will be covering the cardiac and peripheral vascular assessment checkoff. Okay, at this time I've washed my hands, I've closed the door for the patient's privacy, and I will introduce myself. My name is Stephanie. I am a student at the University of Miami, Family Nurse Practitioner Master's Program. Okay, and who do I have the pleasure of working with today?
Hi, Stephanie. My name is Rosie.
Hi, Miss Rosie. Can you tell me your age?
I'm 61.
Okay, at this time, do you have any chest pain,
No,
shortness of breath,
no,
cough?
no,
Okay, I'm gonna assess now some risk factors. Are you a diabetic?
no.
Any family history?
Yes, my mother.
Your mom was a diabetic. Okay. What about any heart attack,
No,
open heart surgery?
no.
Okay. Right. So at this time, I will go ahead and lay Miss Rosie about 30 degrees so I could further do my assessment. Is that okay with you?
Yes.
All right. So this is my stethoscope. With the diaphragm of the stethoscope, you could hear high-pitched sounds. And with the back part, this is called the bell, and you would hear extra heart sounds or murmurs, low-pitched sounds.
Okay.
All right. So, at this time, I'm going to inspect Miss Rosie's chest. I see symmetry. I don't see any in the pericardium area. There's no pulsations or heaving. At this time, I could assess now her jugular venous pressure. So to do that, I could grab a ruler and I will place it at the highest point of oscillation and at the angle of Louis from the sternal angle, I have a reading of 1 centimeter, which is a normal finding. Anything less than 3 centimeters is normal. In the event that you would see a greater, it's sign of the patient's fluid status, and anything greater would be a fluid volume overload. And you would see that a lot with congestive heart patients. At this time, I'm going to assess the hepatojugular reflux. So, Miss Rosie, this test, I'm going to be looking at your neck while pressing down on the right upper abdomen area.
Okay.
I'm going to lay you down just a little bit more. Perfect. Okay, so I'm going to press down, and what I would want to see is some engorgement on the pressure. But as soon as I relieve the pressure, it should go down. Okay, so 1, 2, oh, take a look for me on the left a little bit. Perfect. 1, 2, 3. Perfect. Okay, so she did great. In the event of if the engorgement stays there, that's another sign of some sort of fluid volume overload, especially congestive heart patients. Now I'm going to move on to auscultation, and I will go ahead and listen to the major parts of the valves. So, on the right sternal border, second intercostal space, you have the aortic valve. Okay. On the left sternal border, second intercostal space, you have the pulmonic valve. On the left sternal border, left fourth intercostal space, you have the tricuspid valve. And on the left midclavicular line, fifth intercostal space, you have the mitral valve. Okay. The mitral valve area is also the apex of the heart. And there you can hear any kind of the apical rate, the rhythm, it should be less than 2.5 centimeters, so just about the size of a quarter. In that area, you could also hear some extra heart sounds like S3 and S4. I know that S3 can be heard immediately after S2, and S4 you could hear right before S1. With murmurs, you would hear that with the bell of your stethoscope, and it could be on the grade of 1 to 6. And already on 4, you can probably feel the pulsation, or even see it in some instances. The most common area to hear any kind of murmurs is on the left side, and the most common are the aortic and the mitral. Now you have stenosis and regurgitation. Stenosis is known to be an opening problem, and regurgitation is a closing problem. Okay, and S1 you could hear greatest at the apex of the heart, and S2 at the base. All right, and that concludes my cardio assessment. I will move now onto my peripheral. Okay, Miss Rosie, just a little bit of history in this aspect. Do you have any pain on your legs when you walk?
No.
Have you noticed any skin changes? Any ulcerations?
No.
Okay, perfect. Inspecting her skin. I've been taking a look at her color, any edema, any kind of lesions, and I don't see any of this at this time. Another further assessment is if I could see your hands. I'm going to check her capillary refill. And Miss Rosie has nail polish, so what I can do is just squeeze the bottom of her fingernail, and I should see the capillary refill less than 2 seconds, and I sure do. Another assessment finding would be clubbing of the fingernails, and aside from it being visually obvious, you can check it by placing your nail beds together like this, okay, and finding a diamond, and I do, right? So no clubbing of the fingernails. Next, I could check the upper extremity pulses, and starting off with the radial pulse. So it should be found right here on the right arm, and you grade pulses on a 1, 2, 3 scale, and 2 is normal, and that's what I feel. Next, +2, perfect. Next is the brachial artery, and you can find this right here underneath the bicep. Okay, +2, and +2, very good, perfect. So now we'll move down to the lower extremities, and here I'm looking for any swelling. Now to assess swelling, you will press down on the skin. If there's a 2 millimeter mark of indentation, that is considered a +1 edema. And it ranges all the way to an 8 millimeter indentation, which is a sign of +4 edema. I'm looking at her muscles, a sign of any kind of atrophy. Miss Rosie, do you consider yourself an active person?
Yes, I am.
Okay, perfect, because I'm noticing that she has no sign of atrophy. The next thing that I would want to see is just her calf circumference. So I would grab my ruler and ask you to please bend at your knee. Here I'm also getting another closer look to find for any varicose veins, which I don't see any. And I am measuring the circumference, and I have 33 centimeters. And I would want to compare it with the left leg as well. And I have 33 centimeters as well. So that is a normal finding. Anything greater than a 1 centimeter difference from each leg is abnormal. So again, her temperature is nice, warm, dry, and intact. And I could assess now the lower extremity pulses, including with the femoral. Okay, so I'm going to press down close to your inguinal area. All right, and I could feel her femoral pulse. I'll do the same thing on the left side. Alrighty, next would be the popliteal, which you'll find behind the knee. So if you could just, there we go. +2. And +2, perfect. Next, I could do the dorsalis pedis. If you can just sit up a little bit more for me, just a little bit more. Right there, perfect. You could check that with the tendon here, just right next to it is my trick. And I can feel it, +2. +2 on the dorsalis pedis on the left side. And next would be the posterior tibial. +2. And +2. Next, we're going to do some activities. So the first part is assessing for deep vein thrombosis, and you can do this with the Holman's assessment. So I would support Miss Rosie's leg and hold on to the calf. I don't want to squeeze the calf because in the event that she has a clot, I don't want to dislodge it. So I'm just going to support her leg. And now I'm going to ask you to flex your foot. Do you have any pain?
No.
Alrighty, so we'll do the same thing on the left side. Support, flex. Alright. So you'll find no sign of a DVT with the pain. Next is a Trendelenburg leg raise. And in order to do this one, I will grab a tourniquet and I will place it. I would raise the patient's leg, Miss Rosie, up. There you go. And then place a tourniquet on her thigh. And when I see that the color starts to get more pale, then that's good. In the event that this is a person of color, just look at the bottom of their feet for guidance, okay? So I see some discoloration already. And now, Miss Rosie, I want to see you stand up. So we have the tourniquet still in place. And now what you want to see is that the patient gets color nice and slow. You don't want to see a rush of red or of blood because that's indicative of some type of valve problem. But her color seems normal and looks like her valves are working good. I would do the same on the left side. Okay, I'll have a seat. The next assessment, is called the ankle brachial index. Now this is something that you calculate. And to do this, you first get 2 blood pressures on the right arm and average it out. And you do the same thing with the left arm, 2 blood pressures and average it out. And you get the highest number, and that will be your denominator. You would do the same thing for the lower extremity. So you would get the average of 2 blood pressures on the ankle and 2 blood pressures on the left ankle and get the highest number. And that would be your numerator. You divide them out and you want a grading of 0.90 or higher. That is considered normal. Anything below, there's some sort of arterial insufficiency. So just to go over again, heart sounds, extra heart sounds are found, listen better with the bell of the stethoscope. With the carotid artery, you would hear any kind of murmur with the bell of the stethoscope as well. And when you're assessing the patients, you always want to have them hold their breath when you're listening, and you as a provider as well. Just so it's a reminder that the patient is holding their breath and they should be able to breathe, okay? With the apex of the heart, always remember that the normal diameter size is 2 centimeters. 2.5 centimeters, and it should just be just about a quarter. Okay, and that concludes my cardio-peripheral vascular system assessment. Thank you so much, Miss Rosie, for
You're
your
welcome.
cooperation and your help today.
You're welcome. My pleasure.